Connects visit is a visit 10 to 21 days after delivery. An RN goes out to the home, and these RNs are specialists in pediatric and OB care. They are also lactation specialists, breastfeeding specialists. The visit is offered to anyone, no matter what their financial situation is, what their education level is. We just want to make sure that the babe has a newborn assessment, the mom is assessed, how she's doing, but also that the family is connected with community resources. You first have a newborn assessment where the nurse is weighing the baby, measuring, making sure that the baby is eating, sleeping properly. Safety measures are brought into that, especially safe sleep. The other thing is mom is assessed. How is she doing? Is she coping well? Is she healing well? A big thing with the visit is the postpartum depression screen. Then the third thing that the nurses offer is looking at the family for community resources. Are they taking advantage of all the different resources that are offered in our community? Are they connected with a child care? So when mom goes back to work, making sure the child is safe. Car seat safety. Is the car seat safe? Safe sleep, making sure the babe is eating properly. Do they need breastfeeding support? WIC, is the family needing some WIC support? Or is it medical care, immunizations, making sure that they understand all of those? The resources could just go on and on. There are so many resources in our community, and we want to make sure that each family is connected with those to make them more successful parents, to make them more successful as a family. The nurse relationship with the pediatrician or the providers, professional relationship is very important. If the nurse goes out and first of all she identifies that babe is not back to birth weight, she's going to do a whole survey or assessment of that babe. What is going on? Why is that babe not back? And then she's going to probably call that provider right in the home while she's there and tell the provider or leave a message with the provider that this babe is not back to the weight. The other provider relationship that's very important would be with the mom's provider. If they identify that postpartum depression is high, they want to give mom's provider a call. Maybe it's reconnecting mom with her OB provider, or maybe it's reconnecting mom with a mental health referral, or maybe it's just some additional support that mom needs. But the nurses have that professional relationship with the providers in our community that makes it very important for them to make those phone calls.
It was important to me because upon discharge, he actually got readmitted to the hospital. So it was important for me to have that follow-up visit to know that I was doing my feedings and he was gaining the weight that he needed. So it was good to get his weight checked and to make sure that he was thriving like he should be. I feel like the Family Connects program gave me the right resources that I needed in the community in case I ever needed help with anything. And I think other moms in the community would appreciate those resources as well.
We're very fortunate in our community to have the Family Connects programs. Many communities do not have this program. This program adds reassurance. We just feel that this program is so important for keeping our little ones safe in their home environment and helping our families to be successful in being successful families, being successful parents, and enabling their child to grow in a healthy environment.
Thank you, Genesis Philanthropy, for the Genesis Family Connects program and for giving our family peace of mind.
In order to continue providing this important community resource, we need you. With your financial support, we can continue to sustain and grow this vital community resource. Thank you for your support from all the moms and babes in the community.